Welcome to Mogobe Nuggets of Wisdom podcast. My name is Mompoloki Lerumo Mogobe. Our objective is to enthuse, inspire, energize, and empower entrepreneurs and entrepreneurs of all stripes here in BW and beyond. We do so by inviting these entrepreneurs and entrepreneurs into our makeshift studio. Sometimes we call them to the restaurant, sometimes we go to our studio, and we ask them to share their experiential knowledge, their experiences and their expertise. And we ask them as many questions as we can, aimed at empowering you also as a viewer. Dumela, and welcome to another invigorating, exciting, wonderful, I'm running out of adjectives now to describe Mogobe Nuggets of Wisdom podcast, and I have yet another great guest, Dr. Nature Jawe Mmipi. But before I formally bring her in, can I just ask you to strike that subscribe button? Please just hit that button. More importantly, we are offering opportunities for those who might be interested in partnering with us by way of sponsorship. If you are interested in that, please get in touch with us. Welcome to the studio.
Thank you very much, Mr. Mogobe.
What an honor.
Yes, sir. Thank you very much, and thank you for inviting me. I am also honored.
Okay.
Yeah.
Just share your CV, as it were, condensed version, perhaps.
Okay. My name is Dr. Nature Jawe Mmipi. I am a dentist by profession. I'm married with 3 kids. Mm-hmm. Yes. Should I go on to my educational background?
Yes, that would be great.
Yes. I grew up in Rabani, just 15 kilometers from Gaborone. Mm-hmm. My basic education was in Rabani High School in St. Joseph's College. And then I went to the University of Botswana for my pre-medical course, Bachelor of Science. I did 2 years there. But when I applied for BSc, I wanted to be a medical doctor initially. And then later on, I just changed my mind. And I wanted to do dentistry. That is after we did our clinical exposures. Usually they give us the chance to go to the hospital and observe and see where your real interests are. So I got interested in the dental setting, and then I decided, no, I want to do dentistry. So after the 2 years in UB, I applied for external placement with Ministry of Education, and then I got admitted at the University of West Indies in Trinidad and Tobago.
Wow.
Yes, that is in the Caribbean island.
You call it Trini?
Trini, yes.
Mm-hmm. So, I visited it a few times.
You did? Mm-hmm. It's a very great country, yes. Then after, I went to the University of West Indies. I did a 5-year program, Doctor of Dental Surgery.
But how come you didn't pick the accent? The Caribbean accent.
I didn't pick, but I tried when I was there.
Yeah.
When I was communicating, I tried so that they can hear me.
And they don't necessarily can't tell that you're from far.
Yes. And then after 5 years after completion, I came back home to serve my nation.
Okay,
yes.
So you decided on dentistry from here, or you decided when you were there?
No, I decided when I was still at UB. Mm-hmm. Yes, because when we go for this vacation, for when this is the semester break, something like that, we are given the opportunity to go into the hospitals, Princess Marina, Nyangago, if you are in Francistown, to go and observe for yourself so that it can help you decide what you want to do.
What's the toughest part about being a dentist?
The toughest part about being a dentist?
Most challenging?
The most challenging thing about being a dentist, it's a very tiring job.
How so?
Because it's very physical, like you have to do an operation on each and every patient. So you have to observe your postures. You have to, otherwise you will be suffering from back aches, neck aches. Like it's a very challenging job.
You're mostly standing, right?
No, we are seated on the chair, yes. But then your focus is on somebody's mouth.
Yeah.
Yes. So you need to see how you sit, you need to see how you operate, like the ergonomics you have to observe. Otherwise, after 2, 3, 5 years, you'll be suffering from a backache, toothache. So, but it's you also have to think. Yeah, for every patient, you have to do a special diagnosis, investigation, and then you do a special treatment plan for each and every patient. So sometimes it can be very challenging because some people may come with pain and then you will never know where the pain is. You will be there the whole 2 hours trying to find out where the pain is.
I couldn't help noticing that you have braces on.
I have.
So what procedure does it take to put braces in? What's it called?
You mean to put on the braces is it's an orthodontic treatment. It's done by a specialist. It's a dental specialist called an orthodontist. Yes. So treatment with braces, it ranges from having spaces in between your teeth, crowding, like a lot, to like some of the protruding teeth, you want to bring them back a bit, you know, a lot you can do.
There was a time when it was associated with teenagers. Now everybody does it. Yes,
it's actually easier, and the right time is those teenage years. But when you do dentistry, you get to know that there's that child dentistry or child orthodontist and adult orthodontist. So it's not too late when you are an adult, but the sweetest time is the teenage age.
I noticed that every time you go to see a dentist, the first thing they do is poke sharp objects in your in your mouth. Isn't there a better way?
No. Mr. Mogobe, a tooth structure is very hard. So when you use that instrument that you feel like we are pricking you, is to check if you have any soft areas on the tooth. That is detecting decay, you know, or if you find a black spot.
Every time I go, they just want to put those things. And sometimes it can be extremely painful.
Really? It might be painful when you have a hole or decayed area, but the tooth structure is very hard. That's why we are using that instrument to come in to check if you have any soft spots. Yes.
And have you practiced outside Botswana as well?
No, I didn't. I didn't practice anywhere else except here. After completion, I came back here. I got employed by Botswana government, Ministry of Health.
For how long?
For about 9 years.
Wow.
Yes.
How was that experience?
It was a very, very good experience. I think I needed it. It was a preparation towards what I'm doing now, because I was appointed at Mahalape District Hospital. That was my first station. I worked there for 7 years. Yes. And it was very interesting. Of course, I did clinical dentistry. I got the chance to do...
What's clinical as opposed to what?
Yeah, okay, let me say practice dentistry.
Oh, okay.
Yeah. So I was going to go into a point of community dentistry. That's why I was like clinical as being in a dental surgery, as opposed to community work, going outside to the rural areas.
Now I understand.
Yes, yes. So I did clinical dentistry, but we were so limited. There were limited resources, like after, especially when you are a fresh graduate. So we had like very limited resources. We didn't get the chance to practice the dentistry that we did at school, that we are trained. So it was very limited, but it was a great experience being in Mahalape for 7 years. I got the chance to do community oral health programs outside Mahalape, rural areas, and then we also got the chance to do the school oral health programs. Yes. So another interesting part about working in Mahalape is this one. When after, I think it was 2 years after I got there, the hospital was undergoing this accreditation process. There's this body that accredits hospitals, accreditate hospitals in South Africa.
To grade them or to register them?
No, to kind of make them to a quality improvement. It's a quality improvement body, kind of, yes, to push them into a certain level or certain standards. Yes. So this process, it helped me so much. It helped me so much because I got the chance to know, to develop and implement policies, standards, and procedures that we didn't have When I got there, we didn't have those things like clinical guidelines. We were just working, so they helped me to see myself developing a policy, see myself developing a standard operating procedure, all those things,
So in what way do you say it prepared you for what you're doing now?
Yes, that process, it kind of helped you to appreciate all those components that an organization need to run. Starting from HR, personnel files, risk management, quality improvement, infection control, everything that you need. So when I thought of going into the dental business, I felt ready after that. I felt like I'm ready to do it because now I know what an organization needs to have or to run. We need all these components to be in place, all these policies, all these procedures to be in place. Yes.
To become a dentist, do you need, like in law, to first be a pupil and a pupil master? Or something like that.
Pardon me?
In law, for me to become a lawyer,
yes,
there's a year that I have to spend under a pupil master, or if you like, a trainer, or
like
a
an
mentor.
internship.
Yeah, an internship. Yeah.
Yes.
Do you have something similar?
Yes, you do. They have that.
Tell us about your experience there.
Our first year of work is an internship program. Like you are monitored.
Under a senior dentist.
And you have different rotations that you have to be competent on for you to go into the next year and be on your own. Yes, even the scale that they give you first year is an internship scale. So after that, you graduate into a mature dentist.
When you at MDH, any interesting highlights?
When I was at MDH, my highlights, to be honest, was being part of the accreditation process, number one. Also, the going to do the community work outside Mahalapi. There, it was like an eye-opener somehow to see oral health, we need to do some more work. Yes, so that was always on my mind the whole time, the whole of my career, that there's somebody there in a remote area who doesn't have access to this, and what can I do as an individual, and all those. It was kind of, yeah.
And you say you didn't have enough equipment. What was particularly missing there?
Mr. Mogobe, dentistry is very expensive. So somehow I feel like our government, they have, I understand, they have priorities, like buying an ambulance rather than maintain a dental chair, something like that. So there was no maintenance of dental equipment at all. So you could stay there for a year, 2 years, the chair is not working. There was no maintenance of chairs. So if the chair is not moving up, down,
it's very hard.
You can't do any procedure. Even that part, the handpiece part, if it's not working, you can do a filling, you can do a cleaning, so you could stay 2 years without the chair is not working. Sometimes all chairs are not working, you are just seated.
And you are busy writing letters to the PS, and there's no response.
Yes, there's a problem with maintenance. That is the main thing. Second of all, dental materials. Yes. Such as dental filling materials, those pastes that we use for clean, they were not available.
For a long time?
For a long time.
What is the situation now, if you're aware?
I heard it's deteriorating even more.
Really?
Yes.
So do they turn people back when they need
Yes, they turn people back. What can they do, Mr. Mogobe? The only thing they can do is dental extractions. But Canada is not the only option for a painful tooth or a toothache. That's not an option.
What are the other options?
The other options are root canal treatment. Root canal treatment is whereby you remove that nerve that is paining you. You remove it, and then you treat, and then you fill the tooth. Then the pain is gone, but you still have your tooth in your mouth.
Okay.
Yes. So the prevention that we usually recommend, like dental cleanings, those basic things are not available.
Okay. Talk to me a little bit about tooth care. I mean, an average entrepreneur is presumably busy and is not able to really take care of their teeth. What are the protocols for proper caring of teeth?
Okay, we have four components of taking care of your teeth. Number one, at least you should get time, like after 6 months, two times in a year, you should go and see the dentist for the dental checkup. We need to check for decay, for your gum health, cancers, all those things. It's very important. That is number one. And then number two is the toothbrushing. Right? At least if you are busy, you should be able to brush your teeth.
Yeah.
Yes. With usually we recommend the medium bristled toothbrush, and then a fluoride toothpaste.
What does medium bristled mean?
Okay, when you look at the toothbrush at the store, they are labeled. It's soft, medium, and hard. So the soft means the bristles. The bristles are very, very, very soft. And then the medium is medium soft. And then this is the hard one. Okay, so what I know is that people usually go for the hard one. But that is the one that damages the tooth structure. You find people having some, we call it abrasion, some lesions whereby somebody just, like they have some, the tooth structure is gone, is worn off because of the hard toothbrush, and because of some people, they just apply too much pressure.
And too soft is also...
And then too soft, I don't recommend it because it's just too soft. It doesn't remove plaque from your teeth. Okay. So usually I advise my customers to go for the medium bristled brush, yes. Yeah. But there are times whereby I recommend soft. It depends on the condition on the mouth, I mean. Okay, so and then I also talked about, with toothbrushing, I also talked about the fluoride toothpaste. The toothpaste that you use should be fluoridated.
As opposed to?
As there are some that are not fluoridated. Fluoride.
They are what? How do you know this one is fluoride? What's the opposite of fluoride? Non-fluoride.
Yeah, non-fluoridated.
Fluoridated.
Fluoridated. Yes, it's written on the box. But usually, what I've realized is that those that are in stores in Botswana, most of them are fluoride toothpaste, except those that people are selling outside.
In the street.
Those are some that we find that they don't have fluoride, but most of them, they're fluoridated. So fluoride is a mineral that is very, very, very important for strengthening your tooth enamel. Okay, so that your tooth is resistant to decay and is stronger. So you need that. Even the children who are growing up, they also need that fluoride. Okay, that toothbrushing was number 2, and then number 3 is diet. When you
Before you get to diet, how often are you supposed to brush?
Yes, you are supposed to brush at least twice a day. If you can, it can be more than, but usually at least twice a day, in the morning and in the evening. So in the evening, it should be the last thing that you do before you go to bed. Okay, don't go to bed with food in your mouth. Okay, yes, please, because that's when the decay process happens first, when you are sleeping.
What does the food do when you're sleeping? What happens? What's the process?
Yes, when you are sleeping, the problem with sleep is because there is less saliva in your mouth. So that's when the bacteria finds time to multiply and cause that acid that will corrode your tooth. Yes, so that's why you don't need to be feeding that bacteria by leaving food in your mouth when you go to sleep. So you want to go there clean, and then when you wake up in the morning, it depends. Like I always tell my clients, it depends. The morning, it depends. It can be before you take your breakfast, or it can be after. Yes, but it's clever after. Before, I mean, you can brush after. You can brush after your breakfast, because let's say you take your cornflakes and then you leave for work. So you take your cornflakes, you brush, then you go for work with a clean mouth. So that is.
Yeah. So depends. You say there's another component.
Yes, there's another component, diet. If you are a busy entrepreneur out there, at least you should watch your diet. I know sometimes you are forced to snack, but then diet here, I'm talking about sugar consumption. Yes, drinks, soda drinks, chocolates, biscuits.
Are you saying we should eliminate them?
Please eliminate if you can. Or
Everybody can
or
if they want.
occasionally take those, because those sugary foods. Those are the ones that
The problem is if you take them occasionally, they're addictive, isn't it?
they are addictive, but
So you'll keep wanting to take them. So it's either you're saying we should avoid them,
or go for healthier choices. Yes.
So what are you saying?
For the
Fizzy drinks?
drinks, chocolates, biscuits, all those. You should cakes. You should avoid.
Is that message? That message I don't think is getting through. I don't think the food industry likes to hear that.
Yes, I don't know, but what I've realized nowadays is that we have options in stores. Like I've seen zero sugar, Fanta. I've seen healthier choices. Yes, they use the sugar substitute instead, xylitol.
So no more Coca-Cola.
No more Coca-Cola. That's why I said if you really think you can eliminate, then occasionally take.
But a lot of people will drink the Coke and whatever else, saying that I don't feel anything. But what's the long-term effect?
It's a long-term effect. Yes, it's a long-term effect.
Tell us about how that works in the long run. What happens?
Dental decay. No, when you take sugary foods, obviously you are putting yourself into the risk of getting dental decay. Yes. So dental decay is not something that happens overnight. It takes time.
Am I right in saying, although you are strictly concerned with teeth, the damage is not just to the teeth, it's to other parts of the body as well?
Yes. Sugar and health, gaining weight, you know it. Yes. So if you eliminate, you also get the advantage of a whole body, healthy whole body, not only teeth.
One of your other experiences was at IHS.
Yes.
Tell us about that.
After 7 years of service at Mahalaped District Hospital, I applied for a teaching job at in the Institutes of Health Sciences in Gaborone. Yes, I was employed as a senior lecturer in dental therapy. Yes, I was lecturing to those students who are going for diploma in dental therapy. Yes, that was only for 2 years.
They called you professor, or they called you madam teacher?
I was doctor and mom.
Doctor and mom. Okay.
Yes. So I love the job so much because it kind of forced me to go back and read, you know. It also forced me to improve my speaking, because when I was in Mahalap, I was like office, dental surgery, I couldn't get the chance to talk, to be in front of the, so it kind of, so that was also a preparation towards
what you're doing now.
Yes.
Everything works to today.
You know, that was, those 9 years was really.
So during those 2 years you were a lecturer, any highlights, any memorable points?
At IHS, I enjoyed the teaching job, but the problem with this one is because there were more challenges than, you know, there were more challenges because, like I said, Ghana, when you are teaching the students, you need also to take them for practical. So we're also having challenges with the dental chairs.
Maintenance issues again? Maintenance
issues again, because the school doesn't have the dental chairs. We depended on Princess Marina chairs. So they were not working. So it was a challenge. Like we had to kind of look around Botswana. So, oh, where do you have anything working? Francistown, do you have anything working? You know? Yeah, so, but, so when I was there, I kind of got to think, maybe I felt like I'm still not fulfilling my purpose. I felt like I needed to do more, you know. So yeah, about IHS.
So you then resigned and did what?
Yes, then in 2018 I registered a business, and then I started doing the paperwork that I was doing.
What's the name of the business?
The company that I registered is Tikva Group Pty. Tikva Group.
Okay.
Yes, Pty Ltd. And then I registered the business Authentic Smile Dental Surgery. That was it before I came. That Revive Beauty that we're going to talk about, it was after we opened Authentic Smile. So then that was in 2018, but my plan was to open in 2019. So in 2019 March, I resigned from the public service and went to focus on Authentic Smile. That's when we opened the clinic, March 2019. So
where did you operate from before you came here?
We were here in CBD, we were in Massa Center. Yes.
Okay.
This business was always in CBD, always in CBD. Yes.
It's not moving.
It's not moving.
Yeah, from CBD.
Yes.
Okay. When you started the business, what were the initial challenges?
The initial challenges with Authentic Smile is that I didn't have a funder. Everything that I bought was from my pocket. So we opened in 2019, but in 2018 I started collecting dental materials, dental equipment rather. I started buying, putting in the garage, buying until 2019 and saving. And then when I came to open, then I got my savings to partition. It wasn't looking like this before. It was like you know,
basic.
Basic.
It looks very nice now.
Yeah. So that was the main challenge. I didn't have money there in my account to say this is for Authentic Smile. That was where the problem was.
So how did you overcome that challenge?
I really wanted to do it, Mr. Mogobe. That's why I was collecting equipment, like necessary stuff. I was buying computer. If I have money to buy the desktop, I go and buy a game. If I keep in the garage until I have everything. And then when my equipment arrived from China, that's when I was like, okay, let me go and partition and start business. And we started really well. It was just God, When I started the first month, that was really good. Like we had a lot of customers. So that picked me then.
Okay.
Yes.
So you never looked back since?
I never looked back since.
Okay. Why do you think you had a lot of customers? Is it from the result of MDH and IHS?
I really don't know where those customers were coming from. Because, when you start, you have that thing of thinking, hey, am I going to have customers? Or I don't know, but I think it was word of mouth. You see one customer and then goes and call others, like, come and see, there's a new dentist at CBD, and then they were coming in numbers, and then, and we were very surprised, or, oh, okay, it can happen,
A lot of entrepreneurs say that rent is a challenge when you're starting. How was it for you?
It was a challenge, but the thing is with me, like I said, I knew I didn't have money. So what I did in Massa, I was being sublet, So
You're subletting from someone?
Yes, subletted from someone. So what I did in 2018, I think it was around October, I knew the clinic might open February or March. I paid for those 4 months until
in advance.
In advance. And I think it was until February the next year in advance, just to,
to give you a chance to settle.
To give a chance to settle, yeah. But by then, because I was subletted, we were kind of sharing the rental, so it was not that much. I just wanted one surgery room, so I didn't want big space because I was starting, yeah. So I started really small.
Tell us about your move to Mogobe Plaza and how it's been since you moved.
Okay, in 2021, that was last year, I moved here to Mogobe Plaza. Yes, it's good here because, here the space that I have is big. Like even my customers who were here in CBD was like, every time they come, it's like, here is big. That means there it was too small for them. And then it also coincided with the COVID. Because there it was kind of small, so now because we're in a bigger space, so it was an advantage. Yes, it was advantage looking at the COVID situation. And the business-wise, we don't have much difference because Mogobe, Plaza, and Massa are kind of
in the same neighborhood.
Same neighborhood. So our customers are here in CBD. So we just had to send messages. We have relocated. We are here, and yes, they're coming, and we are having new customers as well. Yeah. I think the fact that we are located next to this big bank, FNB, also when they see the sign, they come in. Oh, you have a dentist here? Let me book. I want to come and clean my teeth. Yeah, yes. But to be honest, 2020 and 2021. I don't want to lie, we also had challenges. The COVID, yes,
Yeah.
we also had to, because
I was also going to ask
Yes.
whether COVID had any positive impact or even negative impact. Any impact?
It's negative because like right now we were open, but the customers were not coming, especially those times that are lockdown.
Yeah, because you're an essential service.
Yes, we were open, but the customers were not coming. Last year when we had that one, is it Delta? Yeah, when we had Delta, everybody was staying home. They didn't want to come to the dentist, you know. But we survived anyway. There were some that were coming, but not like
Not the
before.
numbers you want.
Not like before. Yeah, but we were getting something though. Air.
Okay. And if you're advising a young aspiring dentist, what are the things that they should look out for if they start? What are the key things they should get ready with in terms of ensuring success?
With dental business, expect to pay bills, dental materials. Things are very, very expensive. Mr. Mogobe, to run a dental clinic is very expensive. That they should expect, right? And then, like any other business, there is a good week, there is a bad week. Like any other business, it's not even different from any business.
What material is so expensive in a dental?
All, Dr. Mogobe, all filling materials, things, those materials that we use to measure when you want to make your teeth for you. Everything is expensive.
There's a thing they call cosmetic dentistry. What is that?
Cosmetic dentistry is basically, for instance, teeth whitening and the dental veneers. Have you seen people with very, very white teeth? Like on TV, they have very white teeth. They do the veneers, those white, like that is cosmetic dentistry.
Is it something they apply?
No, actually some are made in the lab, like me, and then you stick there permanently. Yes, so it can be.
It doesn't look natural.
It doesn't look natural in some, but those dentists that are really good, they look good. Yes, yeah.
And is it a field you are getting into?
Not really. I can, but my interest is more into what we call endodontics. Endodontics is more like the one that I just described about toothache, like treating the nerve inside the tooth. Yeah, that's the specialty that I want to do.
A normal dentist doesn't do that?
A normal dentist do that, but I want to be a specialist on that.
What does it take?
To be a specialist, you have to go to school.
For how long?
For maybe 3 years.
Really?
Postgraduate,
you can't do it online.
Yes, I was going to cover this on the future prospects, but let me say I've registered with this dental academy in Dubai. So we start with the postgraduate diploma in that. So if you have money, then you can proceed to the masters. Yes.
Does it have more money or more prospects than cosmetic dentistry?
More money in cosmetic dentistry. There's money there.
Yeah, but you've chosen the other one. You've chosen auto.
Because I feel like that's what I want to do.
Yeah, it's about passion.
Yeah, that's what I want to do. Cosmetic, I will always do it because as a general dentist, you do. Yeah, I will always do it. It's only that I wouldn't be a specialist on it, but I'm doing it now. I'm doing dental veneers, I'm doing teeth whitening, I'm doing it now.
Yeah.
Same thing with this one I'm doing, but I feel like I need to gain more skills and more knowledge on endodontics.
Where are we getting it wrong with our teeth as Botswana, if at all?
Diet. I don't think it's not about cleaning or brushing your teeth. I think it's about diet. Yes.
That's the biggest problem.
That's the biggest problem.
Magwinya and physics.
Yes, and physics, sweets at school. They sell sweets for children. This is just the.
I think sweets should be banned from schools.
Yes, just a rough estimation. When we have 10 kids, 7 of them, they will have dental decay. 1 tooth or 2 will be affected.
At what age?
Let's say under 10.
But those teeth are going to fall off, isn't it, at some point?
Yeah, they're going to fall off, but you will suffer with pain, with dental abscess, pus going on, because the last
No, what I mean, at some point your whole teeth is replaced, your whole set.
Yes.
At what age?
The last one maybe at 13.
13.
Some as early as 11, they will have all shed out. So let's say at 13 latest.
So the point is that it can be very painful throughout that process.
Yes, let's say you get the decay at 5. You have 6 more years, 7 more years of suffering, you know.
Okay.
So which means even the primary teeth you need to take care of. It's very important.
All right. Your business ventures are Tikva Group. What is Tikva Group?
It's a company that I registered.
Tell us about it. What does it do?
It's a mother company, and then I registered Authentic Smile under that company, yes, as a business, and then Revive Beauty Studio under it.
Revive Beauty Studio.
Revive Beauty Studio.
Share a bit more on that one, the Revive Beauty Studio.
Revive Beauty Studio. This business I registered in, I think it was also in 2019. I had this dream of having a very, very luxurious, big, beautiful beauty spa. Like, it was there in my planner, I was planning. I also ordered equipment from China. I ordered equipment thinking 2020, we are good to go. Then 2020 COVID, beauty most affected.
Bang, came with it.
You know, but the equipment came. Nevertheless, they came. It's still there. We haven't opened. I'm kind of stuck because even with this project, I was still using my profits, my savings to buy the equipment. So after COVID, I'm not having much of that. So I'm kind of stuck.
What is so different about this Revive Beauty Studio in terms of what you're planning?
So like this beauty spa, it was going to be a full service beauty spa, like ranging from hair to massages to nails to facials to everything that you think about beauty. Yes, so when you are in Revive Beauty Studio, you can do whatever you want. You can go for a haircut. After that, you can go for a massage. You can go for your nails, for your manis, for your pedi. So it was like a day spa for me. Yes, that I have planned with a very nice interior stuff like that. So that was my dream. So the equipment came. The equipment is there. Now no capital to start.
You mean
but
rental?
I still have.
What capital do you need apart from at least one spa lady to start? And then maybe premises.
Yes, I need a place and then money to partition the place. So the equipment is ready. So that's all I
do you have financial institutions in the country?
Yes, I know.
So why did you approach them?
No, I didn't approach any so far because you know what? I will, but I felt like, okay, I can't do it last year. I felt like I couldn't do it because of COVID. I felt like, okay, let me see how 2022 goes. And then, yes, maybe next year I'll approach.
Chances we should have it by June next year, right?
That's my dream.
Maybe this is the right time to reserve yourself some space in the likes of Mogobe Plaza, maybe.
If it's for free, if the reservation is for free.
Everything costs money.
Yeah, so that's the Revive Beauty Studio story. So that's what I
So it won't be manned by you. You'll have employed people because you'll be busy at the surgery.
Yes, I will have a manager who knows how to manage a spa.
So it is classically a classic diversification strategy. You are diversifying.
Yes.
Tell me about that mindset. When did you come to the realization that you need to diversify? You can't just depend on one source. Like the authentic
Smile Dental Surgery.
Yes.
I just don't know where the mindset came from. I just God, I just like to plan. I just like to sit down, write things, and plan and see myself having this and that. Before I even think of being rich, and I was thinking of just having a spa. Like here before with the Authentic Smile, I was just thinking of having a clinic and being able to do what I want, teach people, go around the offices, teach people, do this. So like I just felt like I have to do it without limitation. So with the mindsets, the entrepreneurial mindset, I just felt like I need to own a spa because I'm also interested in beauty or cosmetology. That's something that I'm interested on. Yes, so I'm like, okay, let me start here, and then yeah.
I noticed that you do business sometimes with your husband. How is it like running a business with family?
It's okay to say because he also have a career that he's focused on. It's not like we are running it 24 hours together, especially with this dental business. I get he doesn't really know much about dental business. He's helping there and there, but he also have a career that he focuses on. He's IT, so it is also stressful.
But I guess if you're both in business, it's complementary.
It's complementary, of course, yes. Because things that are, if I'm busy in the surgery, you can do other things that you can, yeah.
Okay. You mentioned challenges and you've hinted on some of them. Are there any challenges you want to touch on?
Challenges in the business.
Yeah.
Yeah. I mentioned the dental business being expensive. Because think about it, Mr. Mogobe, when you are in a dental surgery, every customer who comes in is a new thing, new instrument.
New problem.
Yes, new instruments wrapped, sterilized, gloves, disposable beep, this, that, everything disposable. Disinfectants, what? To run a dental clinic is very expensive because you have to prepare new, clean things after every patient. So that is one challenge. And then one thing that makes it even more difficult is because with this health business, our customers depend on the medical insurance, you know. So
medical
the problem,
aid, yeah.
medical aid. So I think it's high time our patients they should understand how medical insurance works, because what they do, I think they think what they pay to the medical aid is able to cover the costs. But it's not. You know, it's not at all. So when you explain to them that this procedure is going to be this much and medical aid is paying this much, it doesn't sit well with some. So they feel like, you are expensive, but you are looking at how your business is running. You know, so I think everybody should become more responsible for their medical costs and not depend 100% on the medical aid. They should also understand how their medical aid works, because they have
Is it
have
no
rules.
longer a case of you pay 10% and the rest comes from medical aid?
Yes, that's the expectation. But some procedures, what we get from the medical aid is far less. Some procedures, some is fine, you can pay your 10%. But some procedures, they should understand that it's way less.
But
The cost of the procedure is way less.
The reason we go for medical insurance or medical aid is to cushion that cost. So are you saying we're back to square one again?
No, it's an aid. You should know that you have to pay something sometimes.
And which procedures are expensive? When you talk of
Replacement.
conservative dentistry, root canal, bleaching, unpronounceable prosthodontics.
Prosthodontics, that is the one that is expensive. It's a replacement. Yes, replacement can be removable or fixed. So those dental bridges, dentures, crowns, all those things, those are the most expensive at the dentist. I mean.
Okay.
So those are not, because
Prosthetic implies you can also bring in a false tooth, right?
yes, those are false teeth.
False teeth.
Yes, to replace what we've lost.
How advisable is it to have a false teeth in your mouth? Permanent. You can just fit. It's possible to fit just one, or
If you've
two,
lost,
or the whole lot.
if you lost, it depends. If you lost 3, we replace 3. If you lost 1, 1. It depends. Yes, and with the removable and fixed. Removable is the common one, the denture, that the one that you remove at night. You remember, that's the most common one, and is the cheaper one. It's the cheaper one, but still you'll have replaced your teeth rather than having a gap.
I've come across a joke that it's a senior citizen joke that it's quite a hassle when you want to kiss your spouse. You run around looking for dentures.
So it should be a challenge because it might slip off any time.
And but I think the technology is now advanced. You don't need to take it off when you sleep, right?
No, you have to, because that's another type. But you have fixed prosthodontics, the one that you don't remove. So that one comes also at a higher cost than the removable one.
But what's your advice? If you can afford it, get the permanent one.
Yes, if you can afford it, get the permanent one. But it also depends. We do examination. It depends because these replacements, they are held by the neighboring teeth. So we also check the health of the neighboring teeth. If they are shaky and all, they can't get the fixed one. So we also advise looking at that, getting the x-ray, checking your bone density and all those.
I have a gap myself in my tooth. What's your advice? I leave it as it is, or should I start saving for a replacement?
It depends. I don't know where that tooth is.
It's here.
It's number 1 from the back. Is it
number
the last?
3.
Number 3 from the back. Yes.
Number 2.
Yes, you should start saving for
Why?
the
If
brush.
I don't replace, what happens?
You get your bone get resorbed. You are losing the bone. Like you're gonna have your bone where the tooth was. Like it has been removed. That bone is resorbed. It's becoming thinner and thinner.
And what's gonna happen?
As you age.
And what's gonna happen eventually?
Because it's at the back, because you have other teeth at the back.
One at the back.
Yeah, it's not really bad. But if you didn't have any, you're
Actually,
gonna
there's
have
one left at the back. Actually, I've just remembered that 2 that are gone. There's just 1 at the very back.
If you didn't have any at the back, then you saw patamadika. You're gonna have.
Oh.
Yes, because the bone is going to resorb. It's going to become thinner and thinner.
Unless I get a
you
replacement.
Yes.
And typically, how much does it cost to replace one?
A dental bridge, like the fixed one, around 15,000. Yes.
It's one tooth.
Yeah, but it doesn't come as one tooth. It comes as a 3-unit bridge that you cement there.
So you have to take out.
No, those neighboring, they're going to hold the replacement. Yes.
So what do you mean it comes as 3, not as 1?
Because it comes as
if the neighbors are there, why should you need 3?
We have to prepare the neighbors to hold it.
Oh, and that takes what?
Meaning in
it
terms
takes
of
removing them and putting them back?
No. You are not removing. You're just preparing it so that it can hold. Yes.
Okay. All right. Let's wrap it up by talking about your future prospects.
Yes.
You know, what can we expect from you as a brand and as a company the next 10, 15 years?
Okay. For Authentic Smile Dental Surgery, I want it well equipped, Mr. Mogobe, with the sophisticated equipment that we see nowadays. There's this thing. We have a conference tomorrow, dental conference, and the theme is
online.
No, it's right there at Protea Hotel. It's the theme is Rethink Dentistry. Digital dentistry is the future, something like that. So this digital dentistry is becoming the song of the day nowadays. You should have those equipment so that you don't use those traditional conventional methods to do some procedures in the surgery room. So you need those, and they're very expensive.
Give me an example of what it does.
For instance,
this digital.
Yeah, for instance, when you talk about the replacement, when you talk about the bridge, when you use those sophisticated equipment, you just kind of scan and everything goes into the computer. Then you print your crown, and your crown comes, you cement it right there.
Don't joke.
I'm telling you. Okay. And then the traditional method, I have to prepare the tooth. I have to use that mold to get, and then take it to the lab. They manufacture. It can take a week or 2 trying to manufacture that bridge. But with the digital, you take it there. After 30 minutes, it should be ready. Then I cement it there. And then you don't have to buy those molds. You just use a scanner. It registers in the computer. Yeah. So that is where we are moving. So the
And what training do you need as a doctor?
I think you just need to be trained on how to use the unit. Yeah.
And how big is the machine?
Not big though. It's just a computer, and then there's this thing that comes with a scanner that you use in the patient's mouth, and then it registers in the computer. In the computer, and then on the maybe you set up a small lab. So after registering, you send the information to that machine in the lab, and then it prints your whatever you have scanned.
It's really like science fiction.
That thing, I need it, Mr. Mogobe. Maybe you should buy for me. So that's where I want to see Authentic Smile well kept. And then number 2, I want to open an outreach clinic.
What is that?
Like a clinic outside Gaborone, like a satellite or kind of service center outside Gaborone, where I can always go there maybe twice a week or just to give services outside Gaborone. I haven't chosen the place, but it should be outside Gaborone. That's what I want to see. And then another thing is the one that I'm training. I want to do that post-grad. Yeah, I really want to see myself.
Sounds exciting,
yeah. And then Revive Beauty Studio. Please, I want to see this baby running.
Yeah.
Revive
I
Beauty
can.
Studio.
Anything you put your mind to, you can succeed in doing.
Cosmetology as well. In 10 to 15, I want to see myself in venturing in that business. And then I also kind of thought of having a skincare line or makeup line, something to do with that. But that will be 10, 15. Yeah.
Okay.
Yeah.
All right. As we talk about mentorship, I want you to tell me, A, are you mentoring? And 2, what's your advice to the mentees, dental mentees out there?
Mr. Mogobe, I don't know if I'm mentoring anybody.
You don't know?
Maybe at a distance. I don't know.
You don't have anybody in your own surgery?
Mentoring.
That mentee that is learning from you?
I don't know. They wouldn't be telling me. I don't have any to say. I have 1, 2, 3. I don't know. And then
shouldn't you bring somebody in?
If they're willing to, no problem. Because with this mentorship thing, I think sometimes, like for my case, sometimes I feel like, I'm still new in the business. What do I know?
9 years like is not new.
9 years of working.
Yes, that's not new.
That's not new, but
add to that 7 years of training.
So I think that's one hindrance. I feel like I'm still new. What do I know? I'm still trying to figure out this business thing, and I don't know. But I don't have any mentee to say 1, 2, 3. Right
I think you're more than ready. I've been listening to you. You're more than ready to help others. Yeah,
that will be nice.
Okay, so do you want to be mentored then?
I want to be mentored
by
you, Mr. Mogobe.
Not by other dentists.
Even if I find one, I haven't found one in Botswana, but maybe outside. Yes, to say.
Because not the mentorship I offer is twofold. It's either if you are a startup and you qualify for funding or for the processing through Angel Network Botswana, which we founded in 2020.
Okay, what is that one?
Angel Network Botswana.
I've come across that, but I don't really understand.
Well, I'll tell you everything about it when you have time over.
Oh, okay, that's fine.
Go have a drink at Black. But the point is that that's how I mentor, because I'm chairman of the mentorship committee, co-chair with Mr. Guru. That's one. And then the other one is through the mentorship program that I've designed for young entrepreneurs who are interested in serious entrepreneurs who are interested in real estate. So I offer entrepreneurial mentorship through A&B and real estate mentorship directly.
Okay.
So you have to tell me, I can't do everything else, so I've structured these two.
Oh, okay.
Yeah.
Yeah, then I have to meet you then.
And both of these have T's and C's. Yeah, which
T's and C's.
Yeah.
Yes. So
Okay.
I want to be mentored, but then most of the inspirations I get from online, from Facebook, Instagram. I go through your profiles, people in Nigeria, people in South Africa. I go influencers. I just read and see some young people. I have this makeup line. I have this lip gloss, this, and I'm like, oh, girl, I can do it.
Yeah.
Yeah. So I get inspiration.
Go
from
for it.
online.
I'm going to encourage you.
Yeah.
I didn't know. I just thought you were a tenant. Now you are a mentee potentially. So we'll talk.
Yes.
All right. Now, as we conclude, I want you to look at that. Before you look at the camera, do you have a question for me?
If you can tell me more about funding here
Okay.
in Botswana.
We have banks. At some point, we had 11 banks. So straightforward, traditional banking. You approach the bank, they tell you what their requirements are. You prepare a package, you meet their requirements, and you try and impress your bank manager. That's available. But we at Angel Network Botswana offered, alternative, where there are 48 of us. Seasoned, we like to think ourselves as seasoned entrepreneurs,
Yeah.
because we've been around,
Yes.
and we have a little bit of excess liquidity, some of our savings here and there. We pull them together, and you are a young startup, and you have a business that has investability, it's investable, and number two, it's also scalable, can
Yeah.
grow it.
Okay.
If we find that it's got meets those are the two pillars. But of course, we have a system. For instance, on the Nuggets, I have a 10-point system called Nuggets of Wisdom on Successful Pitching. I would
Okay.
suggest you type and see. It's just a 6-minute video,
Okay.
but it sets out those 10, and you go through them, and if you qualify,
It's also on YouTube.
yes,
I think I saw it.
yeah,
I saw it.
So go through it again now with paying attention, taking notes.
Okay.
And then once you hear what you need more clarification, talk to me.
Okay.
Okay.
Erra.
Leave the viewer with an inspiring, uplifting message there as we part.
Okay. Hello, viewers. I just want to say you can do it. If you have a business idea, write it down, plan it, and be determined to bring that idea into life. So that's what I did exactly. I used to write a lot. Yes, that's all I can say. You can do it.
Okay. Give them all your contacts, everything that's in here. Show them, tell them
Okay.
how they can reach you.
Authentic Smile, we are here at Mogobe Plaza, Authentic Smile Dental Surgery. Our clinic lines 311-9078, 7286-8956. We are also on Facebook at Authentic Smile Dental Surgery, on Instagram at Authentic Smile Dental Surgery.
Okay.
Yes.
No landlines.
The landline, I just said it.
Okay.
Yes.
Okay. No WhatsApp lines, I meant.
WhatsApp line is the same number
Okay,
that I
all
gave.
right.
Yes.
Thank you very much for coming. You've been a
Thank
great
you,
guest.
Mr. Mogobe.
You've done good.
Thank you very much.
All right.